The patients enrolled in this trial were patients with B-cell lymphomas, aggressive or so-called indolent, and these are patients that had had prior therapies that were standard of care or commercially available. They were patients who had relapsed after those therapies or were unresponsive to those. Median number of prior therapies for the entire group of patients was 3. And they were treated with this intravenous bispecific antibody called Mosunetuzumab, which is given during month 1 as a gradually escalating dose. And when the dose for the particular cohort the patient was assigned is reached, that's given every 3 weeks to complete remission. Both patients with aggressive and indolent lymphomas responded to this form of therapy. 40% overall response rate in aggressive lymphomas, 60% overall response rate in indolent lymphomas. The drug was well tolerated, meaning there were no unforeseen adverse events, and we saw responses across dose levels, from lowest to highest. Didn't seem to be a clear dose-response relationship. So the safety profile of mosunetuzumab is what one would expect for a drug whose mechanism of action relies on cell-mediated immunity. Probably the commonest side effect was cytokine release syndrome, which is fever, largely fever in this group, but very mild. So hypotension or low blood pressure is part of that syndrome, but really most of these were grade 1 and grade 2 events, so not very severe. The other side effects were neutropenia, generally GCSF responsive and not associated with septic or infectious event complications. Anemia, which is very common in this type of patient. I'm not sure even how the relatedness, whether there is relatedness, but nothing. There were no unexpected toxicities. The next step in evaluating this drug is to allow additional time to pass, because the follow-up is relatively short. We have some patients who've been off therapy for 2 years without any recurrence. Boy, wouldn't I like to know whether or not at 5 years there's been no recurrence. Now, I don't have a crystal ball and I can't manufacture time, so a little bit of patience is in order. But I do see drug development going on. Completing the study, finding the maximum tolerated dose, letting time pass so that we have a sense of duration of response, and beginning to work on using this drug in other studies in previously untreated patients, together with CAR T-cell therapies and other therapies.